testimony and for your suggestions as well. The chair will now recognize the members for 5 minutes for questioning, beginning with me. HR 8942, I'm going to direct my questions to Mr. Benjamin Smith, my first couple of questions. HR 8942 would require mandatory annual training on the history and culture of the tribes involved for specific employees. Mr. Smith, what is the current format for tribal history and culture training for IHS employees?
Thank you, Chair, for the question. As we know, the Indian Health Service is one of the primary healthcare providers to American Indians and Alaska Natives, but we're not the only federal agency that works with American Indian and Alaska Native governments. So our approach in looking at training, and as you can see in our testimony, we do recommend that each IHS service unit develop a unique orientation for all staff regarding cultural training appropriate to each tribe served by an Indian healthcare facility, understanding that some facilities serve multiple tribes, and there could be distinct differences.
Let me just ask it a little bit different way then. Is there any standard within IHS specific to the format for tribal history and culture training?
Absolutely. And the lens that we have taken and have implemented over the past 3 years is a trauma-informed care approach. As we know, trauma resulting from violence, victimization, colonization, and systematic racism have played a part in American Indian and Alaska Native lives. So on an annual basis, all of our employees are required to take a mandatory training on an annual basis to become trauma-informed.
Specific to this issue, but that's specific to trauma?
Correct, which covers the historical trauma and history of American Indians and Alaska Natives in this country, as well as some of the intergenerational trauma for those who may have not personally experienced what previous generations have done. But that approach really sets a common framework across our system to have a basic understanding of the history and experience of American Indians and Alaska Natives in this country.
I'm going to direct my next couple of questions to Ms. Torres. HR 8942 includes in the list of employees mandated to take the annual mandatory training locum tenens providers or medical providers or practitioners that temporarily fill a need at the facility. Can you expand on whether this type of medical employee needs to receive cultural training, and if so, should they be added to the annual requirement?
I appreciate the question. HR 8942 includes in the list of employees mandated to take the annual mandatory training, also includes locum tenens providers or medical practitioners that temporarily fill in at a facility. I believe that all providers that come to the communities that are placed in those communities need cultural training to learn the best approach possible for competent care. Also gaining the trust of the patient so that you can continue to have that good experience going forward and continue to combat the healthcare comorbidities in conjunction with the patient so that the overall care is achieved. Pijayu.
Okay, and I'm going to direct my next questions to Chairman Erickson and Ms. Torres and Ms. Church. Several written statements highlighted, statements that were provided highlighted that each federally recognized tribe has its own history and culture, and any mandated tribal and cultural training should be flexible enough to accommodate the area the IHS facility and employees are serving. By that I mean geographical area. Can each of you expand on what you think are the best practices that IHS should follow as they offer their current training, and if there are specific ideas we should add to HR 8942 to improve it? Chairman Erickson, you first, please.
Thank you for that question. And you're right. There are, here at Colville, we are 12 different tribes into one tribe now. So there's 4 different languages. We're very unique in that. So there's a lot of culturally involved things that are different for each respective tribe that we represent. So I think there's multiple ways that you can go about this. You can do, online modules, in-person classes, but I think the best approach would be community immersive training because it's very specific to each tribe, and the tribes are similar to us that are confederation, that it's not a one-size-fits-all even within our tribe. So again, that is, I think, getting those involved in the community and our elders will help with that a lot, and creating that training for those individuals.
Ms. Church, if you can briefly give your thoughts on this?
Certainly. There are shared values across many of the tribes. There's diversity, but there's also shared values. So if emphasizing those shared values, I think is very important. Additionally, I think looking to our elders, as we do, to provide that guidance. At the Great Plains Tribal Leaders Health Board, we have a Wiaksapa committee of respected elders across the Great Plains who guide us as we not only do our orientation, but also incorporate traditional cultural values and traditional healing into our work. So looking to those wisdom keepers is an important part of the process.
Okay. And Ms. Torres, very briefly, if you have any ideas.
Yes, thank you so much. I would just want to make sure that they are consulting with tribes early and often on what that process will be. And again, making sure to include our youth and elders, as those are our most precious commodities, and we want to get that feedback and that buy-in from our communities. Pija'u.
Okay, thank you. I do appreciate all of you giving us ideas, and I would hope that you would continue to stay engaged on this very important issue. I'm going to recognize Representative Johnson for 5 minutes of questioning. Thank you.
Thanks.